I'm Roxanne Katungay, and I'm here to present for healthcare management and leadership. During this presentation, I'm going to talk about the introduction to organizational privacy, what is a health information, um, what it has to do with PIA, privacy breach, circle of care, organizational policies. I'm also going to talk about the release of patient and client information, lockbox, the code of ethics. I'm going to talk about the CSA model privacy code integration, the 10 principles of CSA model privacy code, and finally, I'm going to talk about the conclusions. So, for personal health information, what is health information? What is personal health information? Basically, what is considered a personal health information is any health information that can identify an individual regardless of its format. It could be a paper record, electronic record, or even an oral record. To classify it further, they could be classified as a demographics, medical records, or billing records. Demographic information are information such as sex, age, postal code, birth date, and social insurance number, phone numbers, and email addresses. Unfortunately, when this information is combined and narrowed down, the owner of the health information can be tracked. Medical records are whatever patient's medical patient's medical history. The records that have the individual's physical, mental health conditions. They could also be from the current or history of medications. Finally, there are also the medical treatment plans and diagnosis. Examples of this are test results, x-ray scans, and physician notes. And then finally is billing records. It could also contain personal health information along with some insurance data or current healthcare plans. Over here, what is the purpose of collecting personal health information? Personal health information is collected for clinical services and health system planning and management. Healthcare data must be collected to ensure that the care of a patient is delivered in a timely, effective, and accurate manner, therefore ensuring that the patient will get the best outcome possible. In addition to that, healthcare data also helps in resource allocation and continuation of health research that are in place to improve the existing treatments and planning and managing in health system. Over here, what are the obligations of a healthcare organization in protecting personal health information? Protection of health information under their care, legal and ethical obligations, efficiency of healthcare delivery. What are the obligations of a healthcare organization in protecting health information? Basically, the obligation of a healthcare organization is to promote the patient confidentiality that they have to safeguard so the person and sensitive medical details. Basically, the personal and sensitive medical details in every visits must be protected, and it is the responsibility of the organization to ensure that all of the information during a visit is not disclosed or shared to anybody without the patient's consent. The healthcare organization also have legal and ethical obligations that requires them to comply with protection of personal health information in order to avoid legal repercussions. Finally, the healthcare organization is responsible for the continuous efficiency of healthcare delivery. They must be able to facilitate a seamless coordination and transfer of care, securing the health information so that only authorized personnel have access to the records, therefore enhancing the patient's outcomes. In Manitoba, The Privacy Commissioner is the Office of the Ombudsman, which is responsible for overseeing and enforcing the provincial access and privacy laws. It is also responsible for upholding the access of information and privacy rights by investigating complaints and reviewing compliance with the of Freedom of Information and Protection of Privacy Act, which is also known as FIPA, and also the Personal Health Information Act. The Office of the Ombudsman is responsible for both of these. For the Freedom of Information and Protection of Privacy Act, it is Manitoba's public sector privacy law that gives people the right to access their record that are held by public bodies, and they regulate how the public bodies would manage those personal informations. FIPA is also provides an individual FIPA also provides an independent review for processes of people for people that disagree with the access and privacy decisions of the public bodies that makes the act. Personal Health Information Act. Manitoba follows the law called the Personal Health Information Act, or PIA, which allows an individual to access their own personal health information, but with some exception. Under PIA, healthcare organizations are also expected to keep the patient's health information private, safe, and secure. What is a privacy breach? What is a privacy breach? Privacy breach is the improper or unauthorized access to, creation, collection, use, disclosure, and retention or disposal of the personal information. In Manitoba, Manitoba follows the Personal Information Protection and Electronic Document Act, also known as PIPEDA. Therefore, the organization, if an organization is under PIPEDA, which Manitoba is, it has to, and there's been a privacy breach, an organization is required to report to the Privacy Commissioner of Canada, and then they need to notify the individuals that are affected by the breach, and then they must keep a record of all the breaches. Possible causes of breaches are theft, misdirected email, snooping, phishing, breach, and a breach. A theft may happen if, for example, there's been a disappearance of an equipment that, let's say, it contained an encrypted personal information like a USB drive that's not encrypted. Misdirected email happens when an email that contains personal information is sent accidentally to an unintended recipient. The phishing happens when an employee is deceived into providing their personal information, either directly or by going to a fake website collecting personal information that isn't directly related or necessary for a program. Snooping is maliciously accessing or collecting personal health information. Breach is an unauthorized access and disclosure of personal health information that compromises the privacy of that confidential information.